Am I set, Olympia? Yeah, okay. All right,
Yeah.
hello everyone. I know people are still joining, and so we're gonna go ahead and get started because I think we have back-to-back sessions. And so I wanna give everyone an opportunity to share any ideas they may have. I really appreciate you taking the time out of your day to join us. And as you can see, we have a couple of our building principals on with us tonight. And we also have a couple of our associate superintendents. So thanks for joining. So we have had listening sessions with our elementary, middle schools, and now here we are for our high schools. We know that we are still working to figure out the best way that we might be able to increase the density and include more of our high school students back to school 5 days a week. And so we're really excited about listening to some of the ideas. I know the high schools have been really working to really look at the plan and how that might work. But before we get started with your listening sessions, the other groups have found it helpful for me to share some ideas with you before we get started. And one of the things that people have been asking and we've been having conversations about is the staff vaccination. We know that our elementary staff were able to have access to the vaccination last weekend. And this weekend we have the secondary. We know that we did have some elementary teachers that had some adverse reaction to the vaccine, very similar to some of the other vaccines during the second shot. And so because this was a one dose, we spoke with epidemiologists at Stanford Hospital, and some of what the reports that they got from our educators and other people who have taken the Johnson & Johnson, that it is similar to some of those side effects that others have seen, the headaches and chills and low-grade fever that lasts for about 24 hours. So the secondary will have that opportunity this weekend. And then we have added a third weekend for all the people that we have not caught yet. There were some people quarantined at the time. There were some of our outside agencies that work directly with our schools that we were able to provide them with an opportunity to get vaccinated through the Stanford Public Schools. So all of those people are on our list for the third weekend, and along with Dr. Lucero, who will have her vaccination during that last session. I really wanted our staff to have the opportunity to have their vaccinations before I took my turn. And so I will be scheduled that last weekend. So I also did want to talk to you. There have been a couple of people who have asked, as Dr. Calder and Dr. Yoon and other health professionals have helped us determine that this was a time that we could start talking about returning more students to school. What are some of the indicators that we used? And had an opportunity to talk to Dr. Yoon, and this is actually included in a frequently asked questions on our website. So if you missed something that I said, we will push you towards that website. But it really was looking at the decreasing trends in our numbers, both in positivity rates, our hospitalizations, and a decrease in deaths here in Lower Fairfield County and really across the state of Connecticut. And so because of those reasons, they thought that this might be a good time for us to start looking at, especially because there was a 6-week trend. We continued that trend this week. And if you're wondering, where can I find these numbers? Where can I find this information? I would tell you the best place is Mayor Martin does a presentation at 6 o'clock every Tuesday. You go to the city's website, there is a link that you can click on, and actually they have the one since, I think he's been doing this for 16 weeks now, and all of his links are there for you to see. So I really encourage you to go look at that. We also, one of the things that Dr. Yoon also talked about is that DPH at the state level really looked at school districts that were either in the hybrid model or had returned 5 days a week. And one of the things that they noticed that there was really low transmission within our schools. And so that was another reason and another thing that they took under consideration. They also looked at the fact that our community here in Stanford and across actually the country, more people are being vaccinated, not just our staff, but people in the community. And so, of course, you're going to have less people who are going to test positive. And therefore, we look at the community spread to determine what the school spread is going to look like, or the people who may test positive coming into our schools. And then the last thing that he really focused on is the fact that we have been in a hybrid model and we have practiced our mitigating strategies like wearing our masks, which is really their #1 strategy that works well, getting our students to have good hand hygiene. And for those reasons that we're not trying to teach those things right now, who would have ever thought that a 9th grader or a kindergartner would keep on their mask all day and really tolerate it really well. So for those reasons, they really felt like that this was the time for us to start thinking about how we would move our students back in school and increase the density in our schools at this time. The next thing that people have asked about is contact tracing and any changes to the contact tracing. There really aren't any major changes to the contact tracing here in Stanford, but the one thing that I think is really positive is that the city has increased our access to contact tracers. So we have a plan that extends our contact tracing availability, and the principals receive this information that they have night hours now that are specifically for Stanford Public Schools. There were people available to us in the evening before, but now they have identified hours and people who would be working those hours, and that is 7 days a week. So we really appreciate the fact that our health department really is working to make sure that we're able to have the resources we need to contact trace at all of our locations. The last thing that I want to just share a little bit about is the fact that Mayor Martin has done an amazing job as we transition back into school to make sure that all of our testing sites in Stanford remain open. And he even worked with our community-based, our student-based health centers so that we're able to have students have access to a test, and actually even staff have access to a test if there is a student-based health center at your school. And I know that AITE uses RIP's student-based health center. So these are all a great thing that we have available to us, not only in our schools, but if you look across the city, we have more testing sites than we've ever had before, and there are less lines than we've ever had before in terms of having access to a COVID test if you're not feeling well. So those are the highlights that I know a lot of people in our other sessions were like, it's nice just to get a sense of the questions that people are asking. And now I really want to take a moment, because this session is a little bit different than the others, because we at the elementary and middle schools were able to really work out a plan for how we were going to reintroduce our hybrid students 5 days a week. But at high school, it became a lot more complicated. And so I will tell you, the leadership at all of our high schools have been working really hard to come up with a plan, and they vetted a lot of different options. And on Monday, we had a discussion about one that seems to have some really good prospects to it. So I'm going to turn it over to Ray Manka at this time to see if he wants to just kind of talk us through. If you were on the Board of Education meeting last night, you may have heard me talk a little bit about this, but he'll be able to put a little more details into it. So Ray, if you want to share at this time, that would be great.
Sure, thank you. Welcome everybody and good afternoon. As Dr. Lucero said, we do have multiple challenges with all of our schools and our school returns. some of the unique challenges at the high school, considering Stanford High School specifically, if we were going to have 1,400 students come back as our hybrid all-in, we'd be looking at lunch waves that were one of our primary concerns. And I know that people might think, well, there's so many other things to look at, but we need to make sure that we've got seats for all of our kids. We've got seats that are properly distanced and or have the mitigating factors to allow for safety in regards to eating lunch. So that really remained one of our challenges. So as Dr. Lucero mentioned, meeting with the principals from the high schools, we were able to come up with some ideas that might allow us to kind of work around that challenge. And one of those ideas was for us to be able to have a modified bell schedule, almost like an early release, where our instructional periods would be about 40 to 43 minutes long. Times haven't been established yet, a 5-minute passing time. And that would allow us to have an early release at about 12:40 or 12:45. And that would then allow for our students who could grab and go lunches. They could take their buses, they could walk home, and then it would allow for students who might need some assistance, either social, emotionally, or academically, to stay behind, work with some of our staff, and be able to get those credits or those grades that they need to be able to get back on track for success. So those are a couple of the things that we were discussing. Along the way, whether we have, the lunch or no lunch in regards to the issue with the number of students in the cafeteria, we still have to worry about our, if we need to have barriers, if we go inside the 6-foot spacing. So I know that Kevin McCarthy from Stanford Public Schools has been working with the schools to come up with the one-arm bandit barriers. And we're excited for those to be able to come in. That would be one of the mitigating factors for keeping our students safe and our staff safe. Our students in the classroom would still be at a 6-foot distance away from the teachers. So they would be within that distance as well, and they'd have all of their PPE. So, we've really thought about everything that we can to make sure that we can keep our students and our staff as safe as possible in this transition. One of the other items, and I know it was mentioned in the board meeting, was considering the drop-off, the pickup, and also walking through hallways with students. So we'd have staff strategically placed. We'd even consider doing a potential for a staggered release at the end of the school day, whether students were walkers or different parts of the building, to ease that traffic flow through the hallways. So been working with some great people. And we're very hopeful that these ideas seem pretty reasonable, and within the time frame of somewhere later in April, I think that these are some pretty doable options.
Thank you, Ray. I really appreciate that.
Sure
And
thing.
so at this point, we are going to turn this over to Mrs. Delaflore. Thank you. Mrs. Delaflore, who is going to be our host this afternoon. This is a really good opportunity for you to share some of your ideas. So she's going to, she'll take you through the process.
Thank you, Dr. Lucero. Hello to all of our staff participants. As you can see, what we will do for the next section, for the listening session, is either you can type your questions into the Q&A feature and we will read those questions. Or if you would like to actually speak, you can raise your hand and I will move you over as a panelist, and we would give each speaker 2 minutes to speak for anything they would like to speak on. So we actually have a question in the chat right now. What happens when a student tests positive? Who will be quarantined? Is it just the students around the positive case or the entire class? And what is the plan at elementary school right now for quarantines?
So we are starting with the plan at elementary schools to quarantine the whole class if there is a positive case in our middle schools, and we're assuming at our high schools, we have to have a complete plan in place to present to our health department, but we believe that it will be similar to our middle school, which is a airplane manifesto type model where you have everyone in a seating chart and you would count the health department would help us identify the students who are within 6 feet in each of the classrooms, and that around that student, and those are the people who would be quarantined.
Thank you, Dr. Lucero. Drew Denbaum, I have moved you over as a panelist, so if you would like to speak, you can right now.
Drew, are you able to unmute yourself?
Yes, how about now?
Hi, Drew, we can hear you now.
Hi. Aside from the many other logistical problems, my major concern is abandoning 6-foot social distancing in our poorly ventilated high school. It is undeniably not in the best interest of our students and staff to reduce distancing to 3 feet just because the CDC says to maintain 6 feet to the extent possible. The hybrid schedule has been working well at West Hill, and there is no compelling reason to put everyone's health and safety at risk for the final weeks of the year, especially when we will all be faced with the spread of new COVID variants that may not be stopped by current vaccines. I have no doubt that the district will be criticized if a surge in COVID cases results from a change in social distancing rules. Why take the risk?
Thank you, Drew. I appreciate you sharing. Did you want a specific, were you just making a statement, or did you want me to kind of respond?
I'd love if you would respond.
Yeah.
Thank you.
So Drew, I think you and I have had this conversation before. We really work with our local health department to help us make these decisions. And when we get a final plan, we vet the whole thing with them. We put in as many mitigating strategies, because this is about not just one mitigating strategy, but a suite of strategies that we try to build on top of one another, so that we know that there is no complete way that there is some level of risk, but we want to make sure that we're doing all our mitigating strategies really carefully. So we will continue to work with the health department to make sure that we have those in place. So it's not just the 6 feet, but it's all the other things that we have in place and have done pretty well up until now. But I hear you and I understand you, and we will continue to consider that as we make these final decisions.
Okay, thank you. I'm just saying that one of the reasons it's been working well is because of the 6-foot distancing out of the mix, and to not maintain that. I did hear Principal Menka say that students will somehow be kept 6 feet from the teachers, but I'm very worried for the students as well. And I just don't understand why for just the last few weeks of the year, this is being made. I understand you're relying upon what the city health department is saying, but it still has to make sense.
Yeah,
So
I understand.
I'll be quiet. Thank you.
No, Drew, I appreciate your time.
Thanks, Drew. All right, we have another question in the Q&A box. It says, what options will be available to our hybrid students and families who are fearful of returning to full-time 5 days a week learning? We've been told that schedules will not be changed, and many students are afraid of returning to packed classrooms again.
So we are at our elementary school and our middle school, we are working with individual families that are uncomfortable with returning to school with a specific plan for each of those students. We actually have had less than a dozen students at our elementary level, and that's the only group that's gone in thus far, that have said that they did not want to return to school. And so individual principals are working with them to come up with a plan for making sure that they either are transitioned to distance teaching and learning, or that they are provided with additional support through their hybrid model. So we would, as we develop the plan, finalize the plan for high school, we would address that issue.
Thank you, Dr. Lucero. Right now, we don't have any questions in the Q&A. I do not see anyone's hand raised, but if there's someone out there who would like to share a suggestion or has a question or comment. Okay, here's another question. Have we heard the voices of parents and faculty about their thoughts on reopening? Are there any efforts that are being made to gather thoughts of the students beyond the listening session, such as a survey?
So we, a suggestion was made for us to have the listening sessions. And so if there is something that we would want to move forward with additional surveys or sending out something different, we can always consider that.
Dr. Lucero, can I just add that we've also had the core committee, which is a very large, broad group of representatives that have been very involved in all the decision-making along the way and involved, which include teachers, community partners, parents, educators. So I think that's been a helpful voice for us as we've made some of our decisions as well.
Olympia, you're on mute.
Sorry. I did want to mention, as we're waiting, if you decide or you think of something later, you'd like to submit some formal feedback, we do have a dedicated email that is spsreopening@stanfordct.gov. You can send questions, comments, suggestions to that email if you happen to think of something later. And here is it looks like it's a comment that's in the Q&A. Just said, I would like to request a student survey be sent out by the district because we have a lot of students who are scared to speak in a public forum, but may have a lot to say. So
Okay.
thank you for that.
Yeah, and if anyone has any suggestions of questions we would put in the survey, that would be a good thing to submit to this website and this email address also. And then we can work with buildings to determine whether or not that's something we want to move forward with. But I appreciate the suggestion.
All right, we'll just give it a little bit more time. Here's another question. The high school core committee has not had an opportunity to discuss the plan. We are meeting on Monday. That's a comment. Here's a question. Would DTLA schedule have to be changed since teachers teach both? Students who do not feel comfortable can't easily transition into DTLA due to courses not always being offered in both. So I think the question is really about, and I don't know, Ray, maybe you can add some light to this, just would we be able to change, or would we change DTLA schedules because some teachers are teaching both hybrid and DTLA?
Yeah, so because we share students and we share staff, both the hybrid that came back full and those that were participating in the DTLA, we would have to have a similar schedule. So that would have to happen for both of those groups.
Thank you. I don't see any hands raised, and oh, here's another question that just came through. How will schedule changes be handled if there are students who want to go to DTLA? Will there be overcrowding in those classes? And are any students being forced to come back?
No students will be forced to come back. The requirement from the Connecticut Department of Education is that we have distance teach at this point is that we have distance teaching and learning at least through the end of this academic year. And Olympia, you have to remind me the second part of that question.
I'm asking about DTLA, like what will happen with schedules if there are students who want to go to DTLA and there's already overcrowding in those classes?
Yeah, so we would have to see if there was space in the classes. This is really done by level. So we met with the elementary principals and some staff to try to figure out what we were going to do for this issue at elementary school. Same thing with middle school, and we would do the same thing for high school. The goal is to, have continuity of education for our students. So we wouldn't want to do a lot of flip-flopping.
Are there any other questions, or is there anyone who wanted to speak? If you would raise your hand now. Here's a question. What happens if a classroom is too small to fit a blue and green cohort at the same time with the 3-foot distance? Would students be rescheduled, and which ones would be switched?
I can give some preliminary thoughts to that. I think it would be it wouldn't be in anyone's favor if we were trying to reschedule students. So if we can find alternative spaces, larger spaces, maybe for Stanford High School, I know we've got a larger room or rooms that we could use that aren't necessarily used for instructional spaces that could be converted with desks to instructional spaces. We might also consider looking at a report that we can run through Power School that will give us free or available classrooms during those times. And we could consider sharing classrooms with open classrooms. But I don't think it'd be anybody's favor to try to reschedule students at this point. So finding alternative spaces would seem most easy solution there.
Thanks, Mr. Manka. Okay, here's a question in the chat. Has the poor ventilation in many classrooms been factored into the health department's consideration? Ventilation is an important factor according to the CDC.
Yeah, so it's one of our mitigating strategies. I know that we work with a commissioning agent at the beginning of the school year to address ventilation issues and any concerns that have come out throughout the year. Those are repaired in a timely manner. And we will continue to look at other mitigating strategies. One of the ones that we used in the fall to, again, add an extra layer was to encourage people to open their windows in spaces that it was available for them to do that. So we will continue to work with our facilities department to determine if there are other mitigating strategies that would be helpful in our buildings.
Here is a question. Is there a way to know that if the ventilation is being monitored? Do we have any data on this in the buildings?
Yeah, so if you have a particular classroom you have concerns about, you can let your building principal know, and we can send over a person from facilities to give you information about your particular room.
I do not see any more open questions in the box, and I do not see anyone with their hand raised. So if there are any other closing remarks, and as I said, you can always, if you think of something later, please email us at the email on the screen.
Well, I just want to thank you all for joining us here today. We really are trying to work hard to figure out what is the next best step for our high schools. So if you do have thoughts, please don't hesitate to reach out here, but also because your administrators are working on this on a daily basis, please don't hesitate to share any concerns or thoughts you might have with your building principals also. Thank you so much for taking your time today, and we will see you soon. Take care.